If you're a respiratory therapist looking to move beyond the bedside, then this episode is for you. Leadership, entrepreneurship, and continuing education. Let's talk about how to make an impact in our profession with Dr. Al Quinones. Yes. Hi, guys. Welcome back to RT Shared Days, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes. Welcome, everyone. Welcome to anyone new. And today, I'm super excited because I have another amazing guest co host, my friend, Dr. Al Canones. Yes. Hi, Al.
How are
So
you, Linda?
good to see you. Glad to have you.
Same
Guys,
here.
I'm going to let Dr. Al Canones take over, but I'm going to read his accolades first. So let me get to his bio. All right. Dr. Al Canones is a board certified as a healthcare executive and a fellow of the American College of Healthcare Executives. Dr. Quinones is the former director of respiratory care at North Shore University Hospital and program director at Malloy College. He is the founder of Quinones Healthcare Seminars LLC, which provides both live and online continuing education programs for healthcare leadership, administration, respiratory care, and cardiopulmonary professionals. Dr. Quinones is the principal investigator for 7 peer-reviewed research abstracts and author of 22 papers published in professional journals. He also served as the New York State Office of Professions of Respiratory Therapy and Polysomnography licensure board member for 10 years in various roles, including vice chair and chairman, and he is our guest co-host here today. Yes, Dr. Candola, so happy to have you here once again.
Happy to be here.
Yes. So let's get the show on the road. All right, Al. So I'm going to ask you what I ask all our guest co-hosts here. What started you on the path of being a respiratory therapist? And from respiratory, how did you move beyond the bedside and then to entrepreneurship?
You said it so smoothly, but for me, it might be just a little bit choppy because the road was choppy. So,
Okay.
well, I've asked a similar question to a number of therapists through the years, not the
Mm-hmm.
whole piece, but the first part about what made you get into respiratory therapy. And I've heard so many nice answers in the past. Oftentimes, people had some experience, some personal experience, right? Or maybe someone in their lives that were, maybe a family member or friend, someone had lung disease or
Right.
had certain exposure that motivated, want to know more, to do more, to help someone that they care about. I
Mm-hmm.
think that's phenomenal. That's great. I can't say that was my situation, unfortunately. Nothing so profound. So for me, I was working in a deli. I was a teenager working a delicatessen, and
Okay.
yeah, and I try to do a good job making my sandwiches, I would, and I want to do something else. I want to do something in healthcare because did have family members in healthcare. So I had that
Okay.
healthcare exposure.
Gotcha.
Like my aunt, for example. So she's a nurse and still is
Mm-hmm.
till this day. Um, I didn't see myself going to college for a long period of time. I did fine in high school, but I just kind of wanted a break. So I decided to become an emergency medical technician. I don't think you know that about me. We've had many conversations.
Okay. No,
I don't
I
think I
did
mentioned
not.
that one. Yeah, yeah,
No. I didn't
yeah.
know.
I
Okay.
went to school, St. Vincent's School of Nursing. It doesn't exist anymore.
Okay.
But they had a 6 month EMT program, Emergency Medical Tech. So I signed up, and it was 2 days a week, I think, for 6 months. Prepared us to work on the ambulance, and I took my state exam, and I was working as emergency medical tech. I
Mm.
enjoyed it. I enjoyed it. I enjoyed working with
Okay.
the patients and different types of patients, with all kind of things, everything from heart attacks to respiratory issues, trauma. Okay, I got a couple traumas. I liked it. I liked being able to be involved at that level.
Okay.
But I wanted to do more. and I also wanted to earn more. So I was thinking about something else that I
Okay.
might be able to take it to the next level. I wasn't sure. And so one of the main people that I spoke to that actually influenced me was my aunt I just mentioned.
Right.
Because again, I didn't want to go to college for a long time. And so the thought of medical school, I don't know,
Wasn't for you.
I didn't think it was for me. So she suggested respiratory therapy. She suggested nursing
Really?
and respiratory.
Okay. Okay.
And then we were talking about the two and what she could see respiratory therapy. She's a nurse. She doesn't know all the details, but she knew enough to say,
Right.
you know what? This is a reasonable thing for you to do, possibly. So then I looked into it. And then, I found a local college. It was Manhattan Community College, had a respiratory therapy
Okay.
program. And that's where it started. Yeah.
Okay. You know what? I didn't know that you started as EMT. That is a
Yeah.
look
Yeah.
at that. Look at that. That's very interesting to know about you. So, okay, so from there, what told you? So now you in the RT profession. So
Right.
what told you like, hey, I can be a leader in this profession? And how did you transition?
I don't think I was thinking I can be a leader. I wasn't thinking that. Um, in school, they required that we become an ARC member. So I became an ARC member in school, and I continued that after I graduated.
Okay.
Now everything is electronic, but back then I got two publications in the mail every month,
Right.
Respiratory Care and the AARC Times. I read them.
Okay.
That's
You
not so
actually read
complex,
them.
right? It's not so complex, right? When it came in the
Uh-huh. Uh-huh.
mail, I read them. And then
Uh-huh.
I was working as a respiratory therapist full time at Jacoby Hospital in the Bronx.
Okay.
That was a
Jacoby.
very active department.
It
I think
very
it still is. I think it still is.
it is. Very much so.
At the
Yes.
time, the director was Sam Burko, who's a gung-ho respiratory therapist, and he expected a lot. And I did a lot of reading. I don't think it was really a lot. I just read what came in the mail. I read what
Nice.
came in. So then they had a structured shift report there. So in the morning, day shift, night shift, and we would talk about each one of the patients. So, but I had been reading a lot. So oftentimes I would quote things that I had read the previous day or two. Like, well, I
Okay.
read respiratory care. They said so and so and so. Now I was a new grad. I didn't have experience, but I can read.
Right.
So
Right.
so I was
Okay.
able to share what I had learned academically, through the journals.
Mm-hmm.
And then over time, as I gained experience, I would pair that with the experiences. Well, the article said so and so. And you know what happened to me the other night? Either, aligned or didn't align. So I was kind
Right.
of thinking, but I was speaking up oftentimes about things that I had read. So I did this,
Mm-hmm.
I was thinking about it. I did a lot of that. And then some people teased me about it. I remember some people would call me professor or whatever. And I was 20 years old. Um, and then one of my coworkers, his name is John, maybe 6 months later, a year later, he was complimenting that. And then at one point, he knew faculty at a school that doesn't exist anymore. It was the
Okay.
Hufford Hospital Corporation Respiratory School. HHC actually had a school that they had a nursing
Okay.
program, an X-ray program, and
Okay.
respiratory. Have you heard about
I,
that?
I I know some of my old colleagues that went through
Yeah.
that program.
So
Mm-hmm.
he was a graduate of that program and he knew the faculty. And he said, I think they have a part-time instructor position. You should apply because you're so knowledgeable. I said, I don't think I'm that knowledgeable, John. He says, you are. I said, I just read the stuff that comes in the mail. Anybody can
Mm-hmm.
do it. Anybody can do it. Just take the time to read what comes in the mail. I mean, if you're a member.
Mm-hmm.
Um, he said, no, I think you should do it. So I applied and I got I hadn't finished my bachelor degree yet. That was a concern for me too. Because I
Okay.
remember the job said bachelor preferred. And he said, I think you can do it. I think they're going to like you in your interview because you're knowledgeable, Al. I said, all right. So I applied and I got the job as a clinical instructor, bedside clinical.
Okay.
So that's where it
Nice.
started. I wasn't thinking about being a leader, leading anything. I was just maybe just sharing some things that I've learned and was continuing to
Mm-hmm.
learn.
Sharing is caring. Mm. I
And then
love
from
that.
there, later on a full-time, part-time position, then a full-time position. Now I was a full-time instructor at some point, having
Okay.
left the bedside. Well, I was still at the bedside as a per diem, but not a
Gotcha.
full-time job. That's like a year later or so.
Okay. Okay. So
Yeah.
which one, so what was your, out of everything you've done, what position did you like the most? Or
Everything has pros and cons. Everything has pros and cons,
definitely.
pluses and minuses. Usually I had two jobs. Like even when I was teaching, I was often a supervisor or supervisor
Mm-hmm.
clinical coordinator. I had different titles through the years.
Yeah.
And then my first director job. I had an assistant director job at North Central Bronx Hospital.
Okay.
Supervisor, and then got promoted to assistant. There were different titles, but it was analogous to being an assistant director. And
Gotcha.
oh, I did operational things that needed to be done, but the
Mm-hmm.
focus was always education for me. It kind of worked
Okay.
like this. When I was at NCB, there were two of us. The director was Herbert Hodge, and then there was Jackie Hurtado and myself, like in the number two role. And we kind of shared responsibilities, but I always kind of gravitated to the educational piece.
Okay.
I kind of gravitate to the operational piece. So although there was overlap, we had to know what each other did, but we
Mm-hmm.
all had our like strong, everyone had strengths and weaknesses, right?
Right.
So
Of
I
course.
enjoyed that. And then from there, I went on to North Shore. I was really pleased. I was hired as director at North Shore University Hospital.
Mm-hmm.
That's probably where I've had my largest impact because I was there for a long time and
Okay.
and as a director.
Got you. I got you. And okay, okay. And I love how when you said you would read the journals that would come in and
Right.
showing that you were self-motivated, right? So when it comes
Thank
to
you.
leveling up in any career, I think just mentioning how you learning, being a continuously learning, a lifelong learner, and willing to do it. Like no one had to tell you to read those things, those journals, those articles that were coming into you. You were you were curious,
Yes.
and you shared, like you said, you would share what you learned. And I
Right.
love that the sharing is caring. So to me, when it comes to um, moving beyond, or your next moving into leadership, those are great traits to have already, to invest in yourself in, and being a self learner. I love it. I love it how
Right.
you just shared
Absolutely.
that.
It's
uh
continuous.
yes, yes. And so okay, so now you were in leadership, all those positions. Now walk us through the journey towards entrepreneurship. What gave you that the light bulb that you can go into leadership? I mean, entrepreneurship.
Well, there are a few different things. What I will say is oftentimes it's someone who's instrumental who kind of lights the spark. So I had started, with a lot of support, uh, an annual conference at North Shore uh, for respiratory therapists, specifically for respiratory therapists. In fact, I
Right, right.
used the New York State Licensure Board. We were the only, I think it's still the only hospital that New York State approved to provide that. And
Mm-hmm.
so, I mean, outside of the AARC, it's just New York State approved. And that was successful. The year one was like 20 people attended. Year
Mm-hmm.
two, I think, was 67. And they
Nice.
continued to grow like 149. By the time that I left, we were getting 300 to 400 people. One time, I think the maximum was 412 people, because
Nice.
it's an annual event. So it kept growing.
Mm-hmm.
And at some point, more than one person probably mentioned, why don't you do this on your own? But the person who kind of said it and it actually stuck, her name is Lorraine Treadwell. She's someone that a friend of mine, a dear friend of mine that I work with on the licensure board, because as you mentioned, I was on the licensure board for a number
Right.
of years.
Mm-hmm.
And this is true. She even mentioned, have you ever read the book Rich Dad, Poor Dad, Al? I said,
Oh,
nope. And she started telling me what it was
good
about.
book.
Ultimately, I bought the book. And it's kind of like a journey toward entrepreneurship also.
Right. That
Yeah,
was a
yeah,
good book. I've
yeah.
read it.
And she
Mm-hmm.
said, I think you should be, I think you can do this on your own. I think you can if you can do it for North Shore, you can do it for yourself.
Right.
I thought about it for a while. I said, yeah, maybe I could do it. And so I just started researching like how do you start an LLC, for example? How
Right.
how would I go about starting a seminar business? So basically, just taking what I was already doing and just modifying it, and and changing it as required. Modifying, changing,
Right, right. Because
at
things
different levels.
change, right, throughout the profession. We're always evolving
Yeah,
and
yeah, absolutely.
catching up with that. Okay, so okay, and this is excellent because so to me, when I'm hearing your story, is that you definitely observe a gap in the need for this, especially in New York,
Yeah,
right?
yeah,
And this made you say, okay, we need access to high quality continuing education, and this gave you, I guess, the would we say the courage? to start
Mm,
your own entrepreneurship?
yeah. We had, so from my perspective at that time, uh, the only local program that was annual was from Night Art. And I think Night Art did a great job and they still do a great job.
Right.
Actually, I teach with them sometime. So they were doing a
Night
good
art.
job. But I think they do twice a year now. But at that time, back then, they had one annual program. So anything else that RTs were getting, again, this is before the proliferation of the internet, right? Have all
Mm-hmm.
online stuff wasn't even available, right? It was not
Right,
available.
right.
So now it's a different landscape now. So I thought to myself, that's only once a year. And I used to hear about people traveling to other states to take classes. Like, say,
Right.
for example, they
The
need to get
struggle.
asthma CEUs. They have to travel to Timbuktu, or they need to get
Mm-hmm.
PFT CEUs or neonatal. All these things weren't that easy to. So night art, that was just my thought process. They were doing a general respiratory therapy program, which was valuable, but it wasn't
Mm-hmm.
specifically meeting the needs of people that need specialization credentials to maintain their
Mm-hmm.
credentials. Um, so I thought to myself, well, I can do the general thing. That's what I did at North Shore. I can do that. But I also, because I had taken the time to take those specialty credentials,
Right,
right?
right.
So I
I
have that
mean,
background. I have the neonatal, I have the sleep, I have the PFT, I have the. So I thought to myself, I can do that, and I can do that's what I was thinking.
mm-hmm.
The first one I did was neonatal pediatrics, and well, one thing I want to say too, if people are thinking to be an move down that direction of entrepreneurship, it's not. My experience was not a smooth one.
I don't
Um,
think any, I mean, do you think anyone's experience?
Probably not.
I don't think so either. Yeah, I mean, shoot, even mine not smooth either. Like you said,
It ebbs
it's
and flows. Yeah, yeah,
right. It's
yeah.
yeah,
I
you
can remember
have
the
to
first couple
mentally.
seminars I did, I lost money. No one starts a business to lose money. You want to
Right,
at least break even. You don't want to lose. Ideally, you want to gain. Of course, you want to gain. You want to do the right thing for your community and you want to profit by it. That's only
right.
normal. It's natural.
Well,
You
that's
don't
what
want to set up a
business
program and
is.
then lose a few $1,000s. Oh my God.
Right,
So
right.
it happened to me a couple times. And then there were some people who said, maybe just forget it. Just don't bother. Why waste your, because it takes so much, you know how much time. One thing I
Yeah.
want to say about entrepreneurship, it's not a 9 to 5 thing. It's a constant
It's
thing.
you think about
Constant.
it all
All
day,
the
every
time.
day. It's like
It
it's
never
hard
stops.
to shut it
Right.
off, right?
It becomes a part of you, right?
Yes.
Literally.
Yes.
And so
Yes.
to devote that much time, that much effort, that much
Yes.
emotion, that much thought,
Yeah.
and then lose money at the end, it's not great.
It hurts.
But I decided to stick with it, and
Of
things did
course.
turn around. Things did turn around.
Yes. And look where you are today. It's like you have to entrepreneurship, you need not just the passion. You have to love what you do, but
Yeah.
you have to have that grit. Like you have to have that. And as a New Yorker, you a New Yorker, like you just
Yep.
have to like just have it within
Yeah.
you to keep it pushing, no
Right.
matter the obstacle.
Right.
Yes, 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 yes.
Mhm.
I love this conversation. So, okay, and so to you, when it comes to growing within the career, why is continuing education so critical?
Well, I can be a little biased with this, obviously. Even though I was on the state licensure board, I'll tell you a side story. I was on the state licensure board again for a very long time, over a decade.
Mm-hmm.
And at one point, they were considering expanding the number of CEUs that are required for respiratory therapists in New York, because we require 10 a year. Some states require 12 or 15 a year.
Mm.
So I asked not to be involved in that decision. I was involved in all the other decisions during my tenure because I didn't want to be perceived as if I was being biased. Because clearly for me, if you increase the number of CEUs, it couldn't hurt me.
Right, right.
I mean, it might not do
Okay.
anything, but it might
I
help.
hear,
So I could be
I hear what
biased,
you're
right?
saying. I
So
hear
yeah.
you.
So my answers could be biased, but I think just like even if you're not going to go to a CEU program, certain number. Well, first of all, why did they put that in place in the first place? Why a CEU requirement? The reason is they want to keep healthcare professionals up to date with things that can benefit patients.
Correct. Yes.
That's why it was put in place. It was put in place for a
Yes.
reason.
Yes.
Uh, all right. So that's part one. So I think anyone reasonably would agree with that because there's too many change. First of all, just remembering what you
So
learned years
fast.
ago is hard enough. But
Yes.
now new things, right?
Of course.
So if
Yes,
you
yes,
want to be
yes.
good, if you want to have a continuous positive impact, if you want your contributions to really matter and matter optimally, like what you do is really making a change, you got to stay abreast of what's going on. You have to.
You have to. That's a fact.
So
That is a
CEUs
fact.
can help that. If you go to quality programs, with people who really care and are putting their best to doing their best to make things, put programs together that will matter, that will help push the business
Mm-hmm.
forward. And that's always my goal,
Yes.
honestly. And
Yeah,
so
yeah.
it can only help you. It cannot
Right.
hurt. Well, it can hurt in terms of you have to pay money for it, but that's the bad side.
Right, right.
It can only help
But
your,
you gotta make an investment. Right. You have to
yeah, yeah,
invest in yourself.
yeah.
And I will say, as somebody that has been to your seminars, a part of your seminars, you putting out good product because
Thank you.
folks, like you said, we do need to keep up with what's going on, and especially in the profession, things are moving, evolving
Right,
faster
right.
with all the technology and everything we have going on. So we have to stay in the know. So that's why it's scary to me when I have coworkers or who just be like, I know I don't, why do I have to do this or go to these things? I know everything. I've seen everything. And then look what happened. COVID came. And everybody, look, COVID kind of turned everything
Yeah,
upside down because
yeah, yeah.
that is an example of something that came and people were just like, oh, well, what are we doing with this, right?
Right, right.
Oh yeah,
Absolutely.
love it,
Absolutely.
love it. And okay, so in regards to entrepreneurship, and you spoke about it a little bit, what were your biggest challenges and how did you overcome them? And I know
Well,
you already mentioned the loss of some funds and
right.
yeah, but
Yeah.
go ahead.
So a big challenge for me is just getting the word out. So
Mm-hmm.
getting the word out. So
Marketing.
what I found is, I mean, I've been doing this since 2008. So it's been a number of years now. What I found is the people who attend the seminars almost always come back.
Mm-hmm. Word of mouth.
Yeah, almost. I mean, some people come back once a year just to get the CEUs that they need. Other
Mm-hmm.
people come back multiple times a year.
Nice.
Either way, I'm pleased. Either way, I'm pleased. But I'm especially pleased. I'm pleased with all of it. I appreciate the loyalty. But those who are
Mm-hmm.
coming back and I know they don't need the CEUs, that really kind of touches me because I feel like they see value.
Correct.
They
Correct.
feel like they're doing it for some reason, right? They're not just, they're not doing it just for the CEUs to get, let me get my 30. Some of my attendees
Mm-hmm.
have way more than 30 C. So New York State requires 30 in 3 years. Many of
Mm-hmm.
my regular attendees, they have way more than that. So
Right.
I feel like they're enjoying it. They're getting something out of it. And I'm committed to it makes me want to try harder.
Right.
Yeah, it
Right.
makes
Right.
me
Right.
want to try
Right.
harder. So
No,
that's
no,
one thing.
no.
So,
Okay.
but even recently, um, and I think you're gonna put a plug in me for me later. I have a program in Punta Cana. We're doing in July, which is the
Mm-hmm.
first time actually leaving the country. It's a resort program, first time.
Okay.
I put it on Facebook. Still, many people respond back like, "Who is this? Is this fraud? Is this fake? Is this scam? Is this spam? Or not scam? Whatever. Is someone they think that there's some kind of nefarious something going on?
Right.
Just getting your
Right.
name out there in a positive way so people know who you are and know that they can trust you.
Right.
That's a big
Correct.
challenge. Do people know you and trust you?
It's true.
And
It's
especially
true.
outside of New York. Like New York, we have all kinds of different kind of names, right?
Right.
Outside of New
Right.
York, it
Right.
might like Quinones. What's that? Quinolone. People mess with my name all the time. So
Me too.
so to get people to know you and trust you that you're trying your best to do the right thing for the profession.
Right.
Yeah.
Okay, okay. But you overcame the challenge by once again just putting out quality seminars and the word of mouth started
Right.
to push out to help you push the name out there. So and I totally understand the challenges of today, because we have all the noise of social media. So sometimes you don't know who when people are posting who they are and
Right.
what their intentions are.
Right.
So you'll get a little,
I get it.
trust me, you'll get a little pushback.
Yeah.
So
Yeah. Yeah.
but yeah, you just have to overcome that. So
Right.
yeah, so thank you so much for sharing that. So in regards to the business, what were your major wins that made you say, yes, this 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 is exactly why I do what I do?
Well, there's two things. One is just looking at the attendance, and the other thing, if programs are well attended or not. Because if programs are not well attended, you can't continue it. It just won't be sustainable because
Right.
there's a financial model. I mean, it's not free to run the programs. There are many costs associated with it.
Correct.
There are speaker costs, there are venue
Mm-hmm.
costs, there are accreditation costs, there are a number of costs. So if you don't have enough attendees, it's just not going to work, right?
Right.
So attendance is a very big thing. Okay, wow, okay, I was able to uh, meet the cost and maybe make a profit. That's a big piece. But on a personal level, just having people, it's not uncommon. It's not uncommon for someone to come up to me after a program, or sometimes months or even years later. I have people even years later and tell me how they took a class and it helped them
Yeah.
at work. Sometimes they'll tell me how they got a different position, they were able to move up, or it
Mm-hmm.
helped the patient. And when I hear those stories, it almost, and they're giving me credit for it somehow. Somehow I
Mm-hmm.
feel like I'm talking about somebody else. Like it can't be me. I'm just the guy who just reads the journals. They come in the mail,
Mm-hmm.
and I'm just trying to make it
No.
through the day like everybody else. My life is full of challenges like everyone else. So tremendous challenges sometimes. And so hearing that, knowing that maybe I actually help someone in a way that they're willing to verbalize it, like months and sometimes years later, that
Mm-hmm.
does mean something to me.
It's
It
everything.
touches me.
It's everything. And folks, just to let you guys know, I have the AEC because of Al's class. Your seminar helped me pass the board after I took it. I failed the first time. And I said, okay, I need a prep course. And then I took Al's Al's class seminar, and I passed after that. So it was good. So I'm one of those people that have to give Dr. Al Quinones his props. I wouldn't have my AEC if it wasn't for
I'm
him.
sure you would have got it later, but thank you for the nice words. Thank you for the
Yeah,
nice
I
words.
give you the
Thank you. I
plug.
appreciate it.
And
Thank you.
with that, this is your time to plug away. You drop the gems on us on entrepreneurship, leadership, how we can move our careers to the next step. And so yes, so please plug away what you have going on. How can we find you and all that good stuff? Oh, and your scholarships.
Okay, okay. All right. So in terms of scholarships, I don't have a formal scholarship yet, but I've been able to establish a scholarship fund in my son's name. I lost my son. I don't want to belabor this topic because it's too emotional. I don't want to cry during it. But I
Right.
lost my son
I
2 years
know,
ago.
Al.
Yep. And
I know. I'm
so I'm
sorry.
giving so I have two scholarships just to help um, uh, those who are about to graduate to take the
Nice.
costs for their MBRC exam and the New York State licensure. So it's a fund that covers those two costs. I've been
Nice.
doing that at
Amazing.
the community college. I'm very pleased to be able to do that.
Okay.
And Malloy College now, and I want to expand it to LIU and Stony Brook as well. That's a
Mm-hmm.
plan for this year. And
Nice.
it's called the Compassionate Scholarship Award because those are two of the qualities that really were outstanding with my son Jared. Uh,
Amazing.
Academics, straight A student. I mean, he's super smart and like the most compassionate, one of the most compassionate people I've ever met. So those are two of his outstanding qualities, and that's what I look for in the award scholarship recipients. So looking to expand that
Excellent.
to more college this year.
Okay.
Okay, with regard to my programs, I so the first half of the year is all set. More than half a year, we have for those who have not completed their RRT exam, we have an RRT review at Long Island University. The end of this month
Excellent.
is
Yes,
fun.
LIU. That's mine.
That's right. That's your school. That's
That's
right.
right.
That's right. I'll be
Shout out
there.
to
That's
them.
right. Doing
Okay.
a 2-day fast track review, and
Excellent.
and that's going to be on February 24th and 25th. And then right
Okay.
after that, the next 2 days, the 26th and the 27th, we have a neonatal pediatric exam review. That's
Okay.
probably the review we've done most commonly. That's the one that's been most in demand. And so
Right.
there as well. Yeah, people really want that
Okay. Yeah,
through the
they need it. They need it. Right. To
and so that's
see.
going to be in person or via Zoom. So uh and
Okay.
it's all one solution. I years ago I used to do all the registration myself also. And like it was
Wow.
way too much. So then about a decade ago we switched over to Solutions times two.
Okay.
Solutions, it's really Solutions X2. They do all the registrations and
Excellent.
they can find those classes on their website.
Okay, so I will put those in the description too. So
Oh,
you
thank you. Thank
shouldn't.
you.
Mm-hmm.
And that big one I really want to talk about is Punta Cana. Again,
Oh
I
yes.
mentioned it earlier. We're going to have a resort program. It's July 7th, 8th, and 9th.
Okay.
And
July
it's
7th.
all-inclusive resort. It's really discounted. You get 21 CEUs right
I
by the
gotta
beach.
I gotta talk to the hubby. I'm
Right
like,
by the beach,
can I
Linda.
can I get to put let me I gotta think. I know I'm supposed to be somewhere in July, but I don't know. I gotta check my calendar.
Yeah, yeah, yeah.
I
Right by
wouldn't
the
I
beach.
wouldn't mind making it to that one. I'll talk to the hubby.
And it becomes a tax write-off. It becomes a tax write-off. Yeah. You get a vacation.
Okay. That's
Yeah,
that
as
okay,
long
okay.
as you're itemizing. If you do standard deduction, it doesn't matter. But if you itemize,
Mm-hmm.
absolutely, it's
Put it
education for work.
as a business right. Okay.
Yes,
All right.
yeah.
You got me thinking. Got me
Yeah,
thinking. Got me thinking. Okay, so what I will do is I will definitely put everything. I'll put it in the description. Just send me the links, and I can have
yeah.
that for the listeners. Anyone that's interested.
Wonderful.
Definite.
All right.
Okay, Al. Well, thank you so much. I mean, it's so refreshing to have Dr. Al Quinones with us, who I've known for many years. But it's just been exciting to hear his story in its entirety, and and having you once again share your journey, your passion for the RT profession. So we thank you for everything you have done in our profession. Amazing. Thank you for your time. So
Okay,
yes,
okay, good.
guys. So, guys, yes, we just wanted to say thank you so much for being here with us. Remember that we are here. RT Share Tea is available on most podcast platforms on Wednesdays, except for when I'm on vacation, and on YouTube on Thursdays. Guys, know that we are growing together. Yes. And remember, guys, to invest in yourself and to only compete with yesterday's version of you. I'll see you next time. Bye.